I feel something that's really lacking in U.S. maternity care is the fact that we don't give our women enough support after they deliver. And so I feel like it's an opportunity not to only check on the baby to see how they're doing, but it's also critical in women's health to make sure that they're making those adjustments as parents and as new moms and fathers.
Centering gives you the understanding that you are not alone. You might be new to this, but there are so many resources out there that you can use.
Parents, I think, feel more empowered to bring up questions in front of other parents because they know that everybody's going through the same thing.
There is hope when you have something in common. There is bonds that it builds. You have people who come from all of these different backgrounds who are able to communicate and to laugh and to have fun and connection and communication with other people who are going through all the same things that they're going through.
You don't necessarily have, friends or families that can visit and help you. But when you go to Centering Parenting and Pregnancy, you feel that way. You have that support.
Anybody who participates in Centering Pregnancy is more ready for what's to come with their newborn and their infant, and they also feel ownership in their care.
We have 2 hours in group. We get to sit and discuss things with the parents while the kids play, but it's also a great time to view the children's behavior and what milestones they met, but also the parents' interaction with their children.
To feel recognized, to feel valued, to feel that their opinion counts, in particular when they are very vulnerable.
The outcomes speak for themselves. The patients are much more knowledgeable. When the patients go to the hospital, it's easy for the staff to know who has had centering. They ask the right questions, they know what's being said.
And so the more that we can provide for the patients while we're here, those are tools that they will be able to use outside of our healthcare walls. Those are tools that they will be using to advocate for their healthcare, to make better choices about food, to even speak up about those social barriers that are prohibiting them from seeking adequate healthcare.
If the pediatrician notices something, complaint or signs or symptoms of depression, they refer that mother back to us and we can take care of it. So in a way, it is a good continuum of care from one to the other.
The thing for me that was most critical was that it was not only the pregnancy part, it was also the centering parenting. And there wasn't any second guessing that we would be doing both. It was, we're going to do them both at the same time.
You get to watch other women empower each other, and it's a beautiful thing. You don't get to see that every day. We live in a world where there's a lot of harshness towards each other in the community and nationwide and worldwide, and it's beautiful to see women holding someone else's hand that they've only known for a couple of appointments while she cries over something she's stressed about.
The lived experience of racism for Black women in this country is much different than anyone else. And I think centering helps to decrease that disparity. And so I love being able to afford women that venue and that area to be able to speak and talk freely and find the support amongst the women in their community.
You'll have other people that's going through the same things you are, or maybe different, but their story may help you and yours might help them. It's different experiences.
We know that getting them people that look like them and who they're willing to take advice from and who have been through the same thing that they've been through, that it helps them more than they're just hearing someone who's never been in their shoes before. It's a little hard for them to feel like someone really understands what they're going through.
We have a health system now that is creating a lot of burnout, and primary care providers are at the top of that list for experiencing burnout. This is a way to reshape the way you provide care for the sake of your patients and yourself, and to open up your ideas and possibilities about what care can look like in the future.
To be able to sit in centering with my patients and experience life with them and through their eyes is amazing to me.
I think it's a really successful group when I've said very little during the group and the patients are the ones who are sharing their experiences. I have the opportunity to make sure that what they're saying is safe and that it's true, and I can redirect them if I need to.
Our providers wanted to do this, and so seeing the impact on our communities and what they are able to bring to the group, it's led to just higher satisfaction, just overall, just really seeing the importance of what this model of care does.
We are, from the very beginning, from the time these babies are babes in arms, we are helping get them ready to start school. We're helping to get them ready for life. We're helping to model for the moms and the dads how to do that with the children. Everything from how you speak to your child, reading with the children, singing to the children, all of those skills. We want them to understand that it starts when they're brand new.
It's already scary enough to know that you're in charge of a little human being. So I just love it because baby gets her health checkup, she gets her teeth varnished. I get advice on what I'm doing right or wrong. She gets to socialize with other babies. It's just kind of all in one. It's not just, you rush into the doctor and you've got maybe 5 minutes with the doctor, but when you're here you have enough time to actually think of all those questions, and half the time if you don't think of them, they're going to be asked of you anyway.
It created a better support system and made me definitely more confident to be ready to be a mom.
To do patient care in a fee-for-service world, it's difficult, and it's harder to find meaning and joy in the work that you're doing without having other things that create a space for more conversation with patients and to get to a level where you feel like you're making a difference in their lives in some ways that you otherwise might feel relatively hopeless about.
For me as a provider, it's therapy. To be able to laugh, talk, and cry with my patients, to build that sense of family and community with my patients, it's very, very rewarding for me.
She's going to be healthy, and the baby is going to be healthy because they're coming here for their well child visits, and that in turn is going to translate into better family, better outcome, and a better community.
Centering parenting is just a great start for the whole family, not just for the babies. It's a great start for the whole family.
And I tell people and they're like, I've never heard of this. I'm like, well, let me be the first to tell you. It's great.